Hello, this is Dr. Rohit Sane, Medical Director, Madhavbag. I have done my MBBS, I have done my fellowship in cardiac rehabilitation from Apollo Hospital. Today we will be talking about blockages and the available treatment options on this disorder. Normally we call this as blockages, but the medical term for this is atherosclerosis or else coronary artery disease. Now, whenever a blockage has been identified in your coronary artery, the search for n number of treatment options begins. We need to understand what all treatment options are available for treating a blockaged coronary artery. Now, as all of us know, there are many invasive options in which we can invade the coronary artery with angioplasty, or else we can open up the whole thoracic cavity by a bypass surgery, or else there are non-invasive therapies also. Now, we need to understand what to take as a decision when a coronary artery has been blocked. What will lead to our decision are typical simple parameters that we need to assess. Consider I have been diagnosed with a coronary artery blockage. The next thing that I am supposed to do is to perform a stress thallium. Angiography helps me to diagnose whether I have a blockage in my coronary artery or not. Now, once I have been diagnosed with a blockage in my coronary artery, the next thing I am supposed to do is to undergo a stress thallium. Now, the question arises, why? Stress thallium will give you two inferences. The first one is whether this blockage has resulted into any damage to your coronary artery or not, and second, whether this blockage is really blocking the blood supply to your heart muscle or not. Based on these two parameters, we can take the next option of deciding whether to go for invasive therapy or whether to go for non-invasive therapy. Talking about non-invasive therapies, can the blood supply to the myocardium increase with the help of non-invasive therapy? Yes. There are n number of invasive therapies which help you to increase the blood supply towards your heart muscle. The only thing that decides whether to go for invasive and non-invasive therapy would be some type of stress thallium or a normal stress test. A simple stress test wherein you have to walk for about 15 minutes on modified Bruce protocol or else 9 minutes on Bruce protocol with a typical ECG which has been monitored by the doctor. If at all you get this stress tolerance test, whether it's thallium, whether it's a normal stress test, if you get your stress tolerance test done, based on this report, we will be able to take a decision whether to go for invasive or whether to go for non-invasive therapy. So, a simple parameter which is called as Metavalue. Metavalue is nothing else but the exercise tolerance capacity of your heart muscle. As your Metavalue is a clear-cut predictor of the exercise tolerance capacity of your heart muscle, this will help us to decide whether to go for invasive or whether to go for non-invasive treatment options. Thus, if at all a coronary artery is been identified with a blockage on angiography, the next thing that you got to do is get a stress tolerance test done, which will help you to take a good decision in the future. For more information, log on to Lybrate. Thank you.